Welcome, on behalf of the Children's Health Fund, the American Academy of Pediatrics, and the National Association of Children's Hospitals. These groups have assembled as partners to support healthcare reform legislation to guarantee access to healthcare for millions of children.
The weight of all of the major pediatric organizations in the United States want to make sure that all of you know that it is compelling and critical that we get everyone in our country covered, and particularly our children. The thing of it is, they really cannot wait anymore. They're not like adults. We miss a critical opportunity to do something that's caring for a condition that's preventable in a child. If we miss that opportunity, we have caused a lifetime of consequences.
So what does it say about the character of our country that we allow millions of children to go without the health care they need and deserve? What does it say about the character of our country that our infant mortality rate is higher than that of 29 other poorer countries? What does it say about the character of our country that UNICEF ranks the United States 20th out of 21 industrialized countries in children's health and safety? This is appalling. Do we really want to be the country that continues day in and day out to neglect the most basic needs of our children? We can do better. We must do better.
If I were to sing now, I would begin by singing this. Poor kids can't vote. Neither can they afford to hire lobbyists to plead their cause or to describe their situation.
If there were ever a time when we have troubled waters, it's now. And if there were ever a bridge that we need over these troubled waters, it's passing comprehensive health care reform.
What would America's future be like if every American kid got off to a healthy start?
It would benefit the country in the long run economically to have a healthy group of young people, and in the short term, I think it benefits the soul of the country to reach out a hand in compassion and to show that we care about all Americans.
This is the time to act, to ensure security and stability for those with health insurance and affordable coverage for those who don't. We need to end discrimination of people who have pre-existing conditions. We need to make sure that we have free preventive care. We must do something to limit out-of-cost expenses, stop gender discrimination, eliminate annual and lifetime caps on coverage, guarantee insurance renewal. We need to prevent insurance companies from dropping coverage for those who are sick or hurt, and we need to extend coverage for young adults.
For the first time, we have a real opportunity, veritably at our fingertips, to make things right in America for everyone, and especially for our children.
Inaction is not an option. We need to keep the momentum building. We've never been as far advanced as we have today. We can do this health insurance reform. We have to.
Let's cut out the political stuff and pass this legislation. It's very much needed.